Thiel. Today we're going to talk about erectile dysfunction. Erectile dysfunction is a common condition that affects males more often as they get older. And interestingly, it is a problem with high blood pressure. It's actually the exact same problem. In fact, when Viagra, sildenafil, was originally developed, it was developed as a blood pressure lowering medication. In the trial, it was very ineffective at lowering blood pressure. However, at the end of the trial, people did not want to return their study meds, and they found out that it helped somewhere else. So sildenafil lowers blood pressure in 3 places: in the blue receptors in the eye, between the heart and the lungs, and in the penis. When we look at these sorts of things, the goal in treating erectile dysfunction is to improve vascular function. If you have high cholesterol or high blood pressure, treating those early can help avoid this problem. Smoking also increases the risk of developing this condition. And medications can be helpful. Generally, for people who are early in their course and generally have normal function, we start with medications like Tadalafil, also known as Cialis. The nice thing about that is that it is giving the greatest range of efficacy. So you can take it anywhere from 20 minutes to 36 hours prior to needing it. There's also a readily available daily dosing, which allows someone not to have to worry about when they may choose to use their Cialis. Oftentimes, it is in the range of $10 to $12 per month with a cash price. So that's where I usually would start. Viagra, also known as sildenafil, is more effective, meaning that it helps people who have more severe disease, not that it changes someone's function to a higher level or at all. It works between 20 minutes and 6 hours. Because it is more potent, it does have more side effects. Side effects are often headaches, nausea, slightly blue-cast vision, which occurs in both. But the symptoms generally only would last 6 hours instead of 36 hours. So some people who get side effects would rather have them for a shorter period of time and would be more likely to use the Viagra. Also similar pricing and quite effective. If those are ineffective, there are other treatments that are available. Oftentimes people are concerned because their spouses feel that perhaps they're not attractive enough or these sorts of things. But these are not aphrodisiacs. They do not cause someone to have interest. They allow you to respond normally to the stimuli around you. If I were to slip one of these into somebody's drink when they're in a social setting or at church or those sorts of things, they're not going to know that they have that there. They're only going to respond under the circumstance that they have stimulation which will allow them to respond normally. And so this is a matter of blood flow. It's a matter of high blood pressure, and we can treat that and allow people to function normally. If you have any questions about this, think you may need treatment, I'd be happy to see you in the office. Feel free to give us a call. Hope you have a